isn't sitting in a prescription bottle, but in something as simple and overlooked as when and how you drink water. I know that sounds almost too simple. You're probably thinking, I've been drinking water my entire life. How could that possibly help my diabetes? Or maybe you're skeptical because you've tried so many things that promised results but never delivered. Supplements that didn't work, diets that felt impossible to maintain, advice that sounded good but didn't translate into better numbers. Stay with me, because what I'm about to share has made a genuine, measurable difference for hundreds of my patients, people who were doing everything right and still struggling. My name is Dr. Williams Thompson, and today I'm going to show you exactly how proper hydration timing can improve your insulin sensitivity by up to 40%. These are real people I'm talking about, not hypothetical cases from textbooks. People in their 60s and 70s who take their medications faithfully, never miss a dose, follow meal plans carefully, measure every portion, check their blood sugar multiple times a day, walk every morning, and still, their numbers are unpredictable. Still, they feel exhausted. Still, they worry every time they get their A1C results back. The frustration I witness in my practice is real and heartbreaking. These are individuals who've been fighting this battle for years, sometimes decades. They've spent money on special diabetic foods. They've given up foods they genuinely love. They've done everything their doctors asked them to do, and they're tired of the constant vigilance, tired of feeling like they're failing even when they're trying harder than anyone else around them. In my years of practice, I've learned something important. Sometimes the most powerful medical interventions aren't the most complicated ones. Sometimes it's the basics we've completely overlooked that create the biggest measurable differences. Recent studies from major medical research institutions have demonstrated something remarkable. Drinking water at specific times throughout the day can improve your insulin sensitivity by up to 40%. That means your body becomes significantly better at using the insulin it has, whether that's your own naturally produced insulin or insulin from medication. The key isn't just about how much water you drink, it's about when you drink it, how you drink it, and what you add to it. Small, strategic changes in timing can create substantial improvements in blood sugar control. Before we go any further, I want to know, where in the world are you watching from right now? Drop your country or city in the comments below. I love seeing how far this message travels, and it reminds all of us that managing blood sugar is a universal challenge we're facing together. Now, this isn't about replacing your medication or ignoring your doctor's guidance. This is about giving your body the foundational support it needs to work more efficiently, so your medications can do what they're designed to do. Let me start by explaining what's happening inside your body as you age, because understanding this makes everything else make complete sense. After 60, several significant physiological changes occur that make blood sugar control genuinely more challenging, even if you're doing everything right. First, your cells gradually become more resistant to insulin. That means they don't respond as quickly or efficiently when insulin tries to deliver glucose into them for energy. Second, your pancreas doesn't produce insulin as efficiently as it used to. So you're essentially working with less of this absolutely crucial hormone circulating in your system. Third, your kidneys don't filter glucose as effectively, which means excess sugar lingers in your bloodstream longer instead of being eliminated. And here's the part most people, including many healthcare providers, completely miss. Your brain's thirst mechanism becomes significantly less sensitive with age. That last point is absolutely critical. You can be substantially dehydrated, even dangerously dehydrated, without feeling thirsty at all. Your mouth might not feel dry. You might not experience any obvious discomfort. But inside your body, at the cellular level, things are going wrong. And even mild dehydration, just 2% below optimal hydration levels, which is barely noticeable to you subjectively, can raise your blood sugar by 10 to 15 points. That's enough to take you from good control to poor control. That's enough to explain those frustrating morning spikes or unexpected afternoon highs that seem to come from absolutely nowhere. Let me tell you about a patient named Gerald. He was 68, and I could see the frustration written across his face before he even sat down in my office. "Dr. Thompson, he said, his voice tight with emotion. "I don't understand what I'm doing wrong. I'm eating carefully, measuring everything. I take my metformin exactly as prescribed. I walk 3 miles every single morning. I've completely cut out sugar and white bread. I've done everything you and my other doctors have told me to do." He pulled out a small notebook completely filled with blood sugar readings. "Look, some mornings it's 145, other mornings it's 185. Yesterday morning, 162. This morning, 178. Same breakfast every single day. Same steel-cut oatmeal. Same measured portion. But the numbers are all over the place." His wife added quietly from beside him. "He tries so incredibly hard. But his A1C just keeps creeping up, from 7.1 to 7.9 over the past year." We methodically went through his entire routine. Diet, excellent. Medication timing, perfect. Exercise, completely consistent. Everything looked absolutely right on paper. Then I asked what seemed like an almost trivial question. "Gerald, walk me through your morning routine from the moment you wake up until breakfast." I get up around 6:30, check my blood sugar immediately, make coffee, drink my coffee while reading the news on my tablet. Then around 7:30, I make my oatmeal and take my medication with a glass of water. "When do you drink plain water?" I asked. He paused, genuinely confused. "When I'm thirsty, I suppose. Sometimes with my medication pills. Is that wrong?" There it was. Gerald went from 6:30 a.m. until 7:30 or even later before drinking any actual water. 8 hours sleeping without fluids, then another full hour awake without hydrating. 9 hours total of progressive dehydration. We made simple, strategic changes. Every single morning before his coffee, he drank warm water with a small pinch of sea salt and fresh lemon juice. 15 minutes before lunch and dinner, he drank a glass of room-temperature water. He carried a reusable bottle and sipped consistently throughout the day. 2 weeks later, he called my office. His voice sounded completely different, lighter, almost excited. "My morning readings have been between 125 and 138 for the past week, every single day. That consistency hasn't happened in over 2 years." A month later, his average fasting glucose had dropped by 22 points. No medication changes whatsoever, just water, timed correctly and consumed strategically. "I honestly thought you were a little crazy," he admitted with a genuine smile at his follow-up appointment. "Water seemed way too simple to actually matter. But I can't argue with my glucose meter. The numbers absolutely don't lie." Before I teach you the specific method that's helped my patients achieve these kinds of results, let me explain the 3 most common hydration mistakes I see in my practice. You're almost certainly making at least one of these right now. Mistake number 1, waiting until you're thirsty to drink. Thirst isn't an early warning system. It's an alarm bell that goes off only after you're already significantly dehydrated. By the time your mouth feels genuinely dry, your blood has already thickened, your glucose levels have already elevated, and your insulin is already struggling to work efficiently. Think of it this way. Your blood is like a river carrying glucose to your cells throughout your body. When that river is full and flowing well, glucose moves smoothly to exactly where it needs to go. When the river runs low, it becomes thick, sluggish, and slow-moving. Glucose gets stuck. It accumulates in your bloodstream instead of being delivered to cells that desperately need it for energy. Mistake number 2, drinking large amounts all at once. Some people go hours and hours without any water, then suddenly drink a huge glass trying to catch up on hydration. But your body can only absorb approximately 200 to 250 milliliters every 15 minutes. That's about 1 cup. Anything beyond that volume just passes straight through to your bladder without actually hydrating your cells at all. It's exactly like watering a houseplant. If you dump an entire bucket of water on it all at once, most of the water simply runs off the sides and the roots stay completely dry. But if you water slowly and steadily over time, the soil gradually absorbs it, and the roots get exactly what they need. Mistake number 3, drinking ice-cold water, especially first thing in the morning or right before meals. I know cold water feels incredibly refreshing, especially on a warm day, but ice-cold water causes your blood vessels to constrict and narrow. When your vessels narrow, insulin has a significantly harder time reaching the cells that desperately need it. Room temperature or slightly warm water keeps your blood vessels naturally relaxed and dilated, allowing insulin to circulate and work far more efficiently. This is especially critical in the morning and around mealtimes when your body is actively processing glucose. Now let me teach you the specific method I use with my patients. I call it the H3 method. H stands for hydration. The first 3 represents 3 key timing points throughout your day. The second 3 represents 3 essential elements that make this approach work. Let's start with the timing points. Timing point number 1, first thing in the morning. This is your single most important timing point of the entire day. The moment you wake up, before coffee, before breakfast, before checking your phone or doing anything else, drink 1 full glass of warm water, about 350 milliliters or 12 ounces. Here's the crucial addition. Add a tiny pinch of natural sea salt. I mean genuinely tiny, just what fits on the tip of a butter knife. And squeeze in juice from about half a fresh lemon. Why these specific additions? After 8 full hours of sleep, your body isn't just dehydrated from lack of water. You've also lost electrolytes through normal nighttime processes. That small amount of sea salt provides sodium, potassium, and magnesium that actually help your cells absorb and utilize the water you're drinking instead of it just passing through. The lemon provides vitamin C and creates a slight acidity that helps stabilize your body's blood sugar response to your first meal of the day. This simple morning ritual accomplishes something remarkable. It signals your adrenal glands to calm down. Those glands naturally produce cortisol, your stress hormone, which peaks every morning. Cortisol instructs your liver to release stored glucose into your bloodstream. By calming this stress response with proper hydration and minerals, you actually prevent that unnecessary morning blood sugar spike. Let me tell you about Elizabeth. She was 72, had been managing type 2 diabetes for 14 years, and her biggest ongoing frustration was her morning blood sugar. She'd wake up consistently at 165 or 175, even though she'd eaten a careful, measured dinner and her bedtime reading had been perfectly acceptable. We started with just this one single change: warm water with a small pinch of sea salt and fresh lemon juice, first thing every morning, at least 20 minutes before her coffee. 3 weeks later, her average morning reading had dropped to 128. Same medication dosage, same evening routine. The only difference was how she started each day. "I wake up feeling genuinely different too," she told me at her follow-up. "More clear-headed, less foggy and confused, and that lower morning number gives me confidence and momentum for the entire day ahead." Timing point number 2, before meals. About 15 minutes before lunch and dinner, drink a smaller glass of water, about 150 to 200 milliliters, just 1 cup. This simple habit does something physiologically important. It prepares your entire digestive system, stimulates enzyme production, and most importantly for blood sugar management. It slightly dilutes the contents of your stomach, which directly slows down how rapidly carbohydrates are absorbed into your bloodstream. When carbohydrates enter your bloodstream slowly and gradually, instead of all at once in a rush, your available insulin can actually keep up with demand. Your blood sugar rises gently and steadily instead of spiking dramatically. Clinical studies have demonstrated this remarkably simple habit can reduce post-meal blood sugar spikes by up to 20%. That's often the difference between struggling with control and maintaining genuinely good management. Timing. Point number 3, during physical activity. If you walk, garden, do household chores, or engage in any sustained physical activity for more than 20 minutes, you absolutely need to drink water during that activity, not just afterward when you're already depleted. Aim for approximately 100 to 120 milliliters every 15 minutes of sustained activity, small, frequent sips rather than large gulps. This consistent hydration keeps your blood volume stable and prevents the blood sugar fluctuations that commonly occur with physical exertion in people with diabetes. Now let me explain the 3 essential elements, the second 3 in the H3 method. Element number 1, temperature matters. Room temperature or slightly warm water is optimal, especially first thing in the morning and before meals. About 22 to 24 degrees Celsius or roughly 72 to 75 degrees Fahrenheit. Cold water isn't inherently bad, but warm water keeps your blood vessels naturally relaxed and dilated, allowing dramatically better insulin circulation and delivery. It's a seemingly small difference that compounds significantly over time. Element number 2, minerals matter. Pure demineralized water alone isn't sufficient. Your cells require minerals to actually absorb and utilize water effectively. That tiny pinch of sea salt in your morning water provides those essential minerals. Natural sea salt contains sodium, potassium, and magnesium in proper balance. Avoid regular processed table salt. It's been chemically stripped of these vital trace minerals. Choose unrefined sea salt or Himalayan pink salt that still contains the full spectrum of minerals your body genuinely needs. Element number 3. Timing consistency matters profoundly. Your body absolutely thrives on predictable routine. Drinking water at consistent times every single day helps regulate your entire metabolic system. Morning water at the same time. Pre-meal water at regular intervals. This consistency directly helps stabilize blood sugar patterns over time. There's one more addition I consistently recommend for my patients. About 1 hour before bed, drink one final glass of warm water with 200 milligrams of magnesium citrate or magnesium glycinate dissolved into it. Magnesium is absolutely crucial for proper insulin function, and the vast majority of people over 60 are clinically deficient. Taking it before sleep serves a dual purpose. It helps your muscles relax for deeper, more restorative sleep, and it keeps your blood sugar significantly more stable throughout the entire night. Everyone asks me this exact question. Doctor, precisely how much water should I actually be drinking each day? Here's a simple, practical formula. Take your current body weight in pounds and divide that number by 2. That resulting number in ounces represents your baseline daily water intake requirement. For example, if you weigh 160 pounds, you need approximately 80 ounces daily. That's roughly 10 standard cups. If you exercise regularly or spend substantial time in warm weather, add 1 additional cup for every 20 minutes of physical activity or heat exposure. How do you know if you're drinking enough? Look at your urine color. It should be pale yellow, similar to lemonade. Not completely clear, which indicates you're actually overhydrated. Not dark yellow or amber, which signals dehydration. Pale yellow is the optimal target. Here's a practical implementation strategy. Get a reusable water bottle that holds approximately 24 ounces. Fill it completely 3 times throughout the day. Once in the morning, once at midday, once in the afternoon. That's 72 ounces total, perfect for most adults. Keep that bottle constantly visible, on your kitchen counter, on your work desk, in your car. Visual reminders work far better than trying to remember on your own. So, what actually happens when you begin this method? What should you realistically expect? In the first week, you'll probably feel like you're running to the bathroom constantly. This is completely normal and expected. Your body is simply adjusting to proper hydration levels. This settles down significantly by week 2. You should notice your morning blood sugar beginning to stabilize, maybe 10 to 15 points lower on average. Not a dramatic overnight transformation, but consistent, measurable improvement. By weeks 2 to 3, you should experience noticeably more stable energy throughout the entire day. Less of that frustrating afternoon energy crash. Your post-meal blood sugar readings should become substantially more predictable and consistent. By week 4, if you check your A1C, you might see it beginning to trend downward. Not necessarily a huge drop immediately, but clear movement in the right direction. And here's what I hear most often from patients. Doctor, I just feel genuinely better. I can't quite explain it precisely, but I feel more like my old self again. That's what proper hydration creates. It doesn't cure diabetes. It doesn't replace necessary medication, but it helps your body work the way it's actually designed to work. Let me be absolutely clear about something critical. This is not a replacement for proper medical care. If you're currently taking diabetes medication, do not stop. If your doctor has you following a specific management plan, continue following it faithfully. What this hydration method does is support your existing medication, making it work significantly more efficiently within your body. I've had patients who, after 3 consistent months, were able to reduce medication dosages under their doctor's careful supervision. Not because water replaced medicine, but because their body's entire metabolic system started functioning more optimally. If you have any degree of kidney disease, talk directly with your physician before substantially increasing water intake. For most people, this approach is completely safe and highly beneficial. But if your kidneys aren't filtering properly, you need individualized professional guidance. If you're taking blood pressure medication, pay close attention as you increase hydration. Proper hydration can naturally lower blood pressure, which is genuinely beneficial, but might require medication dosage adjustments. Watch carefully for any dizziness and report it to your doctor immediately. Let me tell you about Dorothy, who was 74 when we first met. Dorothy had been managing diabetes for 19 years. Multiple medications, various restrictive diets, diabetes education classes at the hospital. She understood carbohydrate counting better than most registered nutritionists. But her A1C had been steadily creeping upward. It was now 8.6, and her endocrinologist was seriously discussing starting insulin therapy. "I feel like I've completely failed," she told me quietly, her voice breaking slightly. "I've done absolutely everything right for 19 years, but my body just keeps getting worse and worse. Maybe this is simply what happens. Maybe I can't fight it anymore." Her hydration habits were terrible. Maybe 3 or 4 small glasses of water daily, if that. Coffee in the morning, tea in the afternoon, but actual plain water, very little. "I never feel thirsty," she explained. "And honestly, I hate constantly using the bathroom. It's embarrassing when I'm out with friends." We started the H3 method together. Yes, for the first week or so, she'd need the bathroom more frequently. But I assured her that her body would adjust within 10 to 14 days. 6 weeks later, she looked noticeably younger when she walked into my office. Eyes brighter, skin healthier, actually smiling. "My numbers have been the absolute best they've been in 5 years," she said, proudly showing me her glucose log. "My average used to hover around 185 to 205. Now I'm consistently 145 to 165. My doctor actually reduced one of my medications." But she said it wasn't just about the numbers on the meter. "I have genuine energy again, real sustained energy. I can think clearly without that constant fog. I even started gardening again, something I'd completely given up on 2 years ago." 3 months later, her A1C results came back at 7.3, down from 8.6. "You gave me my life back," she said, tears streaming down her face, but they were happy tears. "With water, something that costs virtually nothing. I just wish someone had explained this to me 19 years ago when I was first diagnosed." Dorothy's story is exactly why I create these educational videos. Because there are thousands of people exactly like her struggling right now, trying so incredibly hard, feeling completely defeated, when sometimes the answer is genuinely simpler than anyone could imagine. I want to challenge you personally to try this approach for 14 days, just 2 weeks. Follow the H3 method exactly as I've outlined it. Morning water with sea salt and lemon, first thing upon waking water. 15 minutes before lunch and dinner. Proper daily water intake spread consistently throughout the day. Magnesium water before bed. Track your blood sugar carefully during those 2 weeks. See for yourself if the numbers improve. Pay genuine attention to how you feel. More sustained energy, clearer thinking, better quality sleep. If after 2 weeks you observe real improvement, keep going. Make this your permanent new normal. And please, leave a comment telling me what you noticed. Your personal story might be exactly what another person desperately needs to hear to give this method a serious try. If you made it all the way to the end of this video, please type "I watched till the end" in the comments below. It genuinely helps me understand that this message is reaching people who truly need it, and it helps YouTube share this vital information with more people struggling with blood sugar management. And then tell me, are you going to try the H3 method? What's your biggest struggle with staying hydrated? Share your thoughts in the comments. I read every single message. If this information was genuinely helpful to you, please share it with someone who's struggling with their blood sugar, a parent, a spouse, a close friend who could benefit from this simple, practical strategy. And if you haven't already, hit that subscribe button and turn on notifications so you never miss future videos on managing diabetes, improving metabolic health, and living well with chronic conditions. Thank you for being here and for taking your health seriously. Remember, small strategic changes implemented consistently create genuinely measurable results over time. Take care of yourself. This is Dr. Williams Thompson, and I'll see you in the next one.